Well, that's not fun to go after three really great speeches. So thank you so much, Patty and Dan and Susan, for being here. My name is Katie Breslin, and I'm the Domestic Program Associate at Catholics for Choice. And at Catholics for Choice, we work to uplift the majority of voices, Catholics, who support reproductive health care and rights as part of our faith tradition to conscience. And actually, in order to understand Catholics for Choice, I'd love to tell you a little bit about my day and what it's like. I go to a lot of dinner parties, and they, especially with secular crowds, they're like, oh, that's an interesting job. So most of my day is spent talking to everyday Catholics who I think find our website on the result of Googling pro-choice and Catholic next to each other in the middle of the night. And so I get a lot of emails in the morning and phone calls on my voicemail from Catholics who are just frustrated with the Vatican's outdated policies and rhetoric when issues pertaining to women's lives. Although I love to talk a lot, as you could tell, I spend a lot of my time listening to these Catholics, and I spend a lot of my time talking to them about why they support reproductive health and rights, and why they think it's a moral good. And in these conversations with these Catholics, we spend a lot of time, at the end of our conversations, we imagine this world, a better world, where reproductive health care is really accessible. We dream of a world where all women and men are trusted to make their own reproductive health decisions that reflect the current circumstances of their lives. We imagine a world where decisions to start a family are thoughtful and planned. We imagine a world where policymakers and advocates are free to support policies that create a more just and compassionate society. We imagine a world where abortion is safe and legal and truly accessible, and that contraception and childcare are both affordable and available. This is the world that my colleagues and I at Catholics for Choice work towards every day to make the world a better place. And yet, the hierarchy of our church is not representing everyday Catholics and their values when they attempt to use their power around the world to affect public policy and limit access to sexual and reproductive health. At the United Nations, for example, the Vatican lobbies to make access to reproductive health care harder and harder to get in poor countries, and some of the most vulnerable women are in desperate need of access to adequate and safe health care for themselves and their loved ones. Today, more than 40 million people live with HIV and AIDS, while the Vatican continues to lobby against condoms and to block funding for programs to give people the tools that they need to protect themselves and their partners, which is clearly out of touch with what the majority of people would like. In the United States, the Catholic hierarchy's powerful lobby plays a huge role in influencing public policy and affects everyone, Catholic or not, by limiting availability of reproductive health services for everyone. The Catholic hierarchy's ban on contraception and abortion has dangerous impacts on the lives of women, especially on the lives of poor women who rely solely on government-funded programs for access to reproductive health services or to hope to benefit from new coverage meant to provide access to contraception for so many. And we mentioned Humana Vitae, which proves for nearly 5 decades the bishops have been out of touch with how the majority of Catholics, everyday Catholics, live their lives and how we manage our reproductive health. The vast majority of Catholic women use birth control, 99% of us, in fact, which is astonishing to believe, and we do so because we believe it's a moral good. Catholics across the United States and around the world have soundly rejected this teaching on contraception. From Humana Vitae to Hobby Lobby, the U.S. Conference of Catholic Bishops have waged a campaign to control contraception for everyone, to restrict access and curtail conscience, not just when it comes to birth control, but other issues related to reproductive health care. Yet Catholic women, like women all around the United States, do not agree with the Vatican when it comes to these teachings on reproductive health care, their influence in public policy, or the true meaning of religious liberty for each and every one of us. Yes, the bishops would like you to think that they speak for all Catholics and their anti-choice views, but we know that's simply not true. Decades of polling shows that only 10% of Catholics support the Vatican's position that abortion should always be illegal. And about half of Catholic voters believe that private and public-funded insurance plans should include abortion access and coverage whenever a doctor and a woman believe it's necessary. As a Catholic woman in my 20s, this hits home every single day. Access to reproductive health care is something that I think about a lot. It's what a lot of my friends group, this is issues that would really affects our lives and our well-being. I'm not alone in my support for my pro-choice views either as a millennial Catholic. We just did some really incredible polling that shows that 82% of millennial Catholics believe that abortion should be legal in at least some circumstances. The next generation of Catholic leaders is just as invested as those of us who have come before us in supporting access to reproductive health care. These numbers are not new, and they're certainly not surprising for someone like me who works with Catholics every day. And the bishops really do not want you to know that Catholics, the majority of us, do support reproductive health. We just don't want them to interfere with public policy that affects us all. Now let's talk about one example of the bishops interfering in the name of all Catholics. During the debate over health care reform in 2009, Senator Barbara Mikulski, a Catholic from Maryland, was heralded for an amendment to address women's needs in what would eventually become the Affordable Care Act. It was thanks to Senator Mikulski's amendment that all FDA forms of contraception would be required to be covered in insurance plans with no cost to the consumer, which is a huge win for women's consciences and the right to make decisions about our own health care. Yet, aggressive lobbying by the Catholic bishops and their ultra-conservative allies pressured the Obama administration to cave on the Affordable Care Act's contraception coverage rule, creating a loophole exploited by organizations and companies to claim exemptions from the law due to religious objections by the employers. We got a call from a woman who we'll call Sandra, who was affected by the bishop's lobbying. Sandra was a science teacher who worked at a school in the Midwest. She even took a pay cut to take the job that she loved. She really cared about her job. And she soon realized that working under the jurisdiction of the local diocese came with a hefty price tag. When she went to fill her usual birth control prescription, she was shocked to find that her new employer did not cover birth control, regardless of medical necessity. Paying out of pocket for a contraception method that worked best for her, a non-generic prescription, posed a significant hardship on her budget that she and her husband carefully planned. But Sandra especially objected to the bishop's personal interference in her life to make decisions that were, taking this decision to use contraception completely out of her hands, a decision that she needs in order to make sure that she's performing her job the best way that she can every day. Her stories, unfortunately, is all too common. The bishops talk about protecting religious freedom, but they are really trying to get politicians to enable policies they want, oftentimes to exclude people entirely from benefits that would help them. Where's the social justice of that? When even excluding some women will never be enough for the bishops and their allies, the bishops continue to lobby for a broader religious exemptions. They even submitted an amicus brief in the Hobby Lobby case, which I'm sure many of you have heard about that case. Ultimately, the bishops and their allies' campaign made it harder for women to access reproductive health services and fought for an ever broader special rule to allow them to continue doing business as usual. Under their claim of religious liberty, the bishops would like us to believe that religious freedom is only the freedom to impose their beliefs on other people. They talk about religious liberty, but what they really want to do is to discriminate against anyone and control them. Another way the Catholic hierarchy works against real religious freedom is to protect the rules allowing them to fire an employee who uses a method of reproductive health care that the Vatican imposes. Krista Diaz, a lesbian and a Catholic teacher in Cincinnati, faced this when she was fired after becoming pregnant from IVF. The same fate happened to Emily Hex, an Indiana Catholic schoolteacher who also tried to use IVF. This is incredibly unjust, and this is immoral, and the majority of Catholics in the United States oppose this type of discrimination. Continuing efforts by the bishops and their political allies to use religious freedom as a weapon for discrimination is an abuse of what real religious liberty is for every faith or no faith throughout the United States. The right both to exercise our faith as we see fit and not impose our belief, someone else's, and have the right not to have someone else's religious views, even those in our own religion, impose their beliefs on everyone else. The bishops don't speak for the majority of Catholics in this extremist interpretation of religious liberty. The sad truth is that the Catholic hierarchy plays a large role in blocking reproductive health access, not just here in the United States, but around the world, whether it be at the Holy See, where the Vatican continues to lobby against condom use for HIV and AIDS prevention, or the Catholic hierarchy's influence in places like Paraguay, where they recently helped block an 11-year-old incest victim, a girl who was a victim of incest, from being able to access abortion care, even when her and her family decided it was best. The good news, there's good news, is that as Catholics, we follow our conscience, not the dictation of the bishops on these issues. While the bishops continue their drumbeat on these issues, we know we have the ability to make choices based off our own conscience and exercise this right as Americans and Catholics every day. Yet it is important to stand up for these issues who would claim those of the Catholic hierarchy that claim to speak for us on these issues when they lobby for these politics. The voices of Catholic people are an essential part of public policy debates and discussions. Catholics support policies that enable women and men to make decisions about their reproductive health care. And we do so because of our faith and not in spite of it. We must speak out to our political representatives as Catholics. Every day that we Catholics fail to speak out for access to reproductive health care, we silence the voices of women. Every day that we Catholics stand aside and allow the bishops to represent all of us on issues pertaining to sex and reproductive health, we allow the consciences of women to be ignored, dismissed, putting women's lives in danger. Every day we must push forward for better access to these services, not in spite of our faith, but because of it. Equality, fairness, treating others with compassion, the right to social justice for all, these are Catholic values. And at Catholics for Choice, we believe that these values are values that we all share, and we are proud to be among this company of believers to help make the world that we hope it will be. Thank you.